Hello, KSB family. Today I have the opportunity to talk with the medical director of our emergency department, Dr. John Ortman. Good morning, John.
Good morning. Good morning, KSB.
So how have things changed since the COVID-19 pandemic hit us in mid-March in the emergency department?
Wow. Well, I think obviously we take more precautions with both patients and our own health. Our differential is different. Obviously, we're not thinking about flu so much anymore as thinking about COVID and all of its implications.
Does that thought process come to mind, Dr. Ortman, with practically every patient that walks through the door?
Absolutely.
Yeah, it has to, right, for the safety of the patient and your
Sure.
staff?
When you have the number of asymptomatic people spreading a disease, you worry about everybody.
Right. We're recording this on May 1st, and as of today, everyone that comes into our facilities will be wearing a mask.
Correct.
That helps.
Absolutely.
So we have seen about a 50% reduction in our volume in the emergency department. What do you attribute that to? Why?
Well, I mean, it's multifactorial. I mean, I think probably the biggest is fear. When people watch the evening news, what do you see? You see New York City. You see people crowded in the hallways. You see trailers full of dead bodies. And people don't realize that that really isn't the experience in many parts of the country. Lee County, I mean, we have less than 25 positive tests in our whole county. So I think there's a misperception that's generated by the media. They show the worst of the worst and not show particularly what's going on in their own community. ASAP did a nice survey a week ago, and surprisingly about 75% of the people said they didn't want to come because they're afraid they would overload the health system. Again, they get an idea from looking at the news media.
And just one point, I'm sorry to interrupt, but ASAP is the American College of Emergency Physicians?
Correct.
Right, okay.
And there was over 50% felt that they might not be able to be seen because of it. So there's a big perception issue.
And it's much different here, right? I mean, we're
Absolutely.
seeing less volume in our emergency department. As of this taping, we have no COVID patients in-house. We've had a total of 6 COVID inpatients since this pandemic began. So the rural experience, at least in Lee County and at KSB Hospital, is much different. So Dr. Ortman, you and I have had the conversation that on March 1st, if someone is having chest pain at home and they deem that an emergency, it's still an emergency in this COVID pandemic environment. Could you talk a little bit about that?
Absolutely. Chest pain, heart attacks, strokes, appendicitis doesn't go away because of COVID. And I think we run the danger of doing some great harm to people or great harm to themselves if they don't address this because they're fearful they're going to catch COVID at the hospital. It would be a shame for someone to die of a heart attack or a stroke because they were fearful of getting COVID, which 80% of the people do just fine with. So I think we have to get the word out that we're not New York City. We take great precautions when people come in for screening. People are masked, we're masked. If they're symptomatic, they're tested. They're placed in proper protective rooms if they're symptomatic. And so they're going to be safe when they come here.
And let's talk a little bit about that. So what are you and your team doing to keep people safe when they come into the emergency department?
Sure. Well, I think the first thing starts at the front door. People are educated about this when they get there, surprisingly. They understand what's going on. And they're asked questions, and if they respond positive to screening questions, previously they were masked. Now everybody's masked, which is even better. And they're brought into the emergency room, they're screened again. They're put, if they look like they're a possible COVID patient, they're put in a special room, negative pressure room, so that germs don't escape. The staff is properly protected in their PPE. We have now the luxury of some rapid testing, so we'll know in 45 minutes whether they have the disease or they don't. If they do and they need to be admitted to the hospital, we have a whole floor dedicated to that, so we're trying not to mix people together who have it or don't have it. So I think we're doing a lot to keep people safe.
So KSB's emergency department and their team are here, just like they were 2 months ago.
Absolutely, 24/7, 7 days a week. Please do not feel afraid to come. You'll be protected, and we'll address all your problems.
When we drive by KSB Hospital in the front entrance, you see a sign that says heroes work here. This guy is one of mine, and he has been for a really long time. We've worked together for many, many years. He's on the front lines, and I couldn't be prouder of you and your team, John. Thank you so much for everything you do.
Well, thanks, Dave.
Thank you very much.